about how the procedure benefits people, what is the group of IVF patients who will benefit from all this. Dr. Varsha.
Welcome everyone and congratulations to Swami. We being a tertiary center, I think the biggest challenge we face are cases which are failed in other IVF centers. We're seeing women who postpone their childbearing for career growth. We see a lot of male infertility, and Sir Dr. Vasan is a very well-known figure in andrology and an expert in male infertility. And we also see a lot of patients with repeat abortions. So these could be patients who are able to conceive on their own, but then they do not take the pregnancy to a live birth. So we being a tertiary center, we see a lot of, in fact, 30 to 35% of our IVF patients that we see here belong to these 4 categories. And hence we have to really think hard, and if we're just going to do the regular IVF in this category of patients, we're looking at a very small pregnancy rate and very less success.
But I think a time will come when the process gets so standardized, then we may be able to recommend it for even the other patients who are all going through IVF and hopefully get better results. The other advantage of this NGS technology is that one is, of course, that it is extremely precise, and second is that it is very cost effective. PGS, whatever technology was being used earlier, like array CGH and all, it used to be very expensive and not so specific. So now it is cost effective as well as very, very precise. So I think we hope to do more and more of this and help more patients to achieve their dream. The other thing, a big advantage is also that we can transfer a single embryo. So you are reducing the chances of multiple pregnancies, which has its own share of complications associated with it. So you transfer a single healthy embryo and you deliver a term healthy baby. So these are all the advantages of doing PGS with this technology called next generation sequencing, or NGS. Dr. Varsha, would you like to contribute something
of this technique, which can be used in families where there is a known history of certain genetic abnormalities which is passed on to the offspring by either of the partner. It could be the father or the mother. So, and we do have...
I think we have, we would like to tell you that we have actually done one last month. This couple had, the husband was a carrier of a very rare disease which was transmitted to their first child, where the child cannot even move out of the bed. All the muscles are paralyzed, and they have a very short life. So they were extremely keen to have another baby which is not suffering from that particular disease. So we used the technology called PGD. Again, we did the biopsy of the embryos, identified the embryo which did not have that particular chromosomal trait, and I'm happy to say that that patient has, the pregnancy is confirmed. She is about 1.5 months pregnant now. Of course, we are waiting for the delivery, but this baby will be normal and will not be suffering from the same problem which the first child has. And I think, like I said, these are the technologies which can help, and I'm sure there are many people in our population who have gone through all these things and would like to have a healthy baby by some method. And I think
Dr. Vasan and Veena Vasan. I think when we came, we should have that faith. We should have that faith. And we came with that faith, with that trust. And we came forward with this. Now we have a fruitful gift. It's really very nice. We have been trying from 7 years, and today we have the result.
A very beautiful, positive result.
Yeah.
And all hats off to Dr. Veena Vasan and Dr. Vasan and Dr. Vidya Desai. These are the 3-4 important people, most important people who have led to this result.